a big thank you all for coming along in Carers Week to our Carers Open Forum. It's a first for us, so we'll be interested to see how well the format works, and we'd be really interested to hear people's comments back afterwards about what they feel about the format. Whilst we are actually using some pre-submitted questions from carers, then we're actually inviting you to use the chat function too, to ask any questions that you may have or which may be prompted by answers that we get from the panelists, because I'm sure that our panelists would be happy to come back to people with answers to slightly different questions to the ones that are being asked today. So Sam is an author, a carer, and has worked with Carers First across not just Essex and Southend, but other localities. We've just asked her to come along to introduce the event and talk about really why she got involved with Carers First, how she got into the kind of creative writing arena, and just to give us a few words of introduction. So over to you, Sam. Thank you very much.
Oh, thank you very much for inviting me to speak on this important day. So I got involved with Carers First in the summer of 2020. In the middle of the pandemic, I had a memoir and a non-fiction book published called The Fragments of My Father, which I'll just show you here. So this was a non-fiction book mostly about being a carer to my father, who suffers from schizophrenia. He developed the illness when I was 3 years old. And when my mum passed away about 10 years ago, he was then on his own, and he was vulnerable and elderly in his 70s. And in 2016, he began to develop catatonic schizophrenia, where he would collapse into a very rare sort of waking coma, where he couldn't speak or move or talk, but he would be conscious, and he would have to go into psychiatric care. And this was a huge shock to me. For the first time in my life, I was being called a carer. It wasn't even a term I really understood. They would say to me, "Are you a carer?" And I'd say, "No, I'm his daughter," because I sort of thought that being a carer meant you were some kind of expert or a Florence Nightingale figure. And that came as rather a shock to me. When my father was taken into Springfields, I then, if you like, officially became his carer. I have two brothers too, but I suppose I took on the main burden of care. And I was visiting him, liaising with the doctors. And when he came out, I then ended up living with him most of the time to help and support him, because it became clear that he needed to have someone with him for emotional support. I wrote the memoir because I really wanted to explore that experience. I had my father's blessing. He was very happy for me to write about what had happened. And I also thought it would be interesting to compare my experiences with carers from literature, literary figures, and look at them from a new perspective. Suddenly there was a lot more attention on carers. There was much more awareness of carers. Carers, as you know, are often invisible and are not really noticed or appreciated, even though we save the government so much money, and yet carers' allowance is so low. But suddenly there was a lot more focus and a lot more interest in caring. And so I was writing various pieces and discussing the book, and that was when Carers First got in touch and asked me to think of ways that we could collaborate or do something to help carers. So in the end, with me being a writer, we set up a book group. And initially there were about 6 or 7 people. Actually, it's generally stayed that amount. It's like 7 or 8 people tend to come. And each month we would choose a book and just gather on Zoom, because we're all in different parts of the country, and meet and discuss that book. So I think we kicked off early with Piranesi by Susanna Clark. Early on, this was quite interesting. Quite a few of the people who came said they didn't really want to look at novels about the theme of care, and they wanted the group to be a form of escape to explore other subjects. So we tended to focus on novels from all different centuries, The Warden by Anthony Trollope, or more modern novels. We chose the recent Booker winner, and it's just evolved into a really lovely group. And it's a very kind group as well. One of our members is in a very intense caring situation with her husband, so she hasn't always been able to read the book. She just doesn't have the time. She's under pressure, and she was about to leave, but we all said, no, stay with us. This is, we just want you to be able to listen and join in and listen to the discussion, even if, you don't feel you can contribute. So I think, compared to perhaps the average book group, where you would probably get told off if you hadn't read the book, it's like, as I said, it's a kind and it's an understanding group, and various members have said that they really look forward to it each month, especially if they're going through a tough time, because this is just a chance to meet and chat with other people and who are going through the same experience. So 80% of the discussion will be about books and the book and our love for books, what we're reading, but at the same time we can also share any difficulties that we're going through. So the group is quite small, and so we're still looking for more carers from all over the country who might want to join in, and the next group will be on the 21st of June. If anyone today likes the sound of it, you're very welcome to join us. Okay. Thank you.
How your experience of carers is kind of informing how you support other people, and I think other people on the call will really empathise with that the peer support and the friendship and the time and sometimes the really sensible information and advice that carers are able to share with other carers is just a fantastic resource. So it's lovely to hear that. So if we want to move on now to consider perhaps the new carer strategy, I've got Lee Sherman as one of our panelists today, and Lee is a commissioning manager within Essex County Council, and Lee has been hugely involved with the development of the carer strategy. As I know many of you have, there were around 650 carers who were actually involved in the development of the strategy, and I know certainly a sizable proportion of those are within Carers First. Our other panellists are coming from what's called the integrated care system, of which more later. So welcome to Sharon, and I hope welcome to Sarah, if she has joined the call, who is from patient experience at MSE Trust, which are the 3 hospitals in Chelmsford, Basildon and Southend. But on the programme, it says that we're going to have a little consideration of the carer strategy first. This is very hot off the press. It was launched on the 18th of May, so literally less than a month ago, and contains a number of commitments to carers covering the next 4 years. And I know that the County Council and lots of other partners, health and voluntary sector and so on, are kind of working on action plans as to how some of those commitments can be followed up and put into practice. I'm loath to put Lee on the spot, Lee, but I don't know whether you want to talk about the 6 commitments or whether you'd like me to kind of list them and just do a quick summary.
I'll get you to do a summary, Veronica, but I just wanted to say, well, thank you firstly for inviting us along. Apologies in terms of you've got me, and I'm afraid, I'm the best you're going to get today, unfortunately. But I think with the carer strategy, what we recognise is that we aren't doing very well. Things are not great for carers in Essex, and we've tried to reflect that within the strategy. We haven't put in there how we're going to make things change, because that is a work in progress. That document is going to be a live document that we will be revisiting frequently with yourselves as carers across the system to reflect back on how well we're doing with what we've said we will do. We are at the very, very early stages at the moment. We've just literally got the action plans drafted. So on the 18th of May, when we met for our launch event, we invited volunteers, partners, carers to come along and talk about the strategy with us. And they were quite thoughtful and helpful in helping us to start to plan out who needs to be involved and what we need to be thinking about doing. So we're sort of just trying to sort of turn those plans into some kind of an action plan that will have timescales against it. I just wanted to refer to the questions that I was sent yesterday. I have to be totally honest with you, I haven't really had chance to reflect on them. So providing answers at this forum is probably going to be a little bit, you are putting me on the spot, but I will do my best. And in terms of the actual commitments, if you could just give an oversight, Veronica, that would be really helpful. And then I suppose we'll open out to any other questions that I could potentially answer. And if I can't answer them today, I'll take them away and come back to you, Veronica, so you can let the panel know. Is that okay?
That's fine, Lee, and I do appreciate that you were asked to come at very short notice, as it was actually a councillor away day today, and so the members have all taken themselves off and weren't available on this date, unfortunately. So there are 6 commitments in the Essex County Council. It's an all-age carer strategy, so it actually encompasses young carers and adult carers. And there are 6 commitments, and I don't think you'll be surprised by the kind of themes that came out. I said earlier that obviously about 650 carers were involved, and that was a mixture of people doing surveys and a mixture of people actually going along to some focus groups. We certainly had some of the commissioning team come along to some of our wellbeing groups, and we actually had a special event put on for Carers' Rights Day in November 2021 at Colchester, which I know the team went along to and had the opportunity to kind of ask carers what they thought should be in the strategy. And so I think you'll be fairly unsurprised by some of the responses. But the first commitment was that carers should have easy access to information, advice, guidance and support. So it was about people finding the information that they needed, that was relevant to them at the right time, in the right place, in the right format, and not having to hunt around kind of multiple organisations and, you know, being sent from one website to another, or given, you know, a plethora of phone numbers, none of which quite tick the right boxes. And that's the thing we hear a lot, that people say, well, if I'd known that service was out there earlier, I'd have used that last year. If only I'd known that I could have claimed this benefit, if only I'd known about, you know, council tax reductions or blue badges or anything else, you know, then I would have done something earlier. And obviously, the earlier that people get the information, the earlier they're able to act on it. So there's definitely something there about easy access and early access. The second commitment was about having professional practice and processes. So that was really about saying we need to get professionals to identify carers, whichever door they come through, whether it's health, whether it's social care, whether it's, and health can be the GP or it could be the hospital, whether it's a charity, whether it's a faith group, whether it's just a neighbour. You know, we want people to be able to have those conversations and say, oh, have you actually thought about, you know, the fact that you might be a carer and there might be something out there that would support you. It's about carer awareness, and it's a huge thing. I mean, we put down professional practice and processes, but really it's a thing across all our communities, isn't it? That, you know, we all need to kind of identify people and at least be able to suggest to them the possibility that they are a carer and that there is support out there for them. The third commitment is about improving transitions, and there are so many transitions, and we have people that are transitioning from being a young carer into the adult services. There are transitions for the people that the carers are looking after. So parent carers looking after somebody who is transitioning into different services. There are transitions all the way through people's caring journeys, whether people are living with them, whether people are living in their own homes, whether people are going into residential settings. And of course, there's the biggest transition of all, when people are no longer in a caring role, and how we support people through those processes, because it is a huge change to somebody's way of life, at every stage of that journey, and we need to kind of put the right support in the right places. The fourth commitment was about increased opportunity to access good quality support. And this commitment is the one that encompasses things about respite breaks, and just breaks from the caring role in general. The opportunity to do things with other carers, the opportunity to do things on your own, the opportunity to do absolutely nothing at all, or the opportunity to go away and read that Trollope novel that you've always had on your to-do list. But it's about having that time for you to do whatever you want. And I think there's a lot of conversations to be had about how we better support people with breaks. The fifth commitment is about carers' needs and rights being understood and recognised. That kind of links in back to the second one with the professional practice and processes. We know that people don't identify as carers. People identify as, partners, children, parents, neighbours, friends, but they don't identify as carers. And so that's a hard one. But sometimes we need somebody else to identify it and to suggest to them that they should be doing something. And that's kind of linking back to number 2, I think. It's just about getting carer awareness up the agenda, wherever we are, whatever setting we're in, wherever we work, whatever we do on a voluntary basis, wherever we live. And the 6th commitment is that carers will be the experts that influence, shape, and are involved in the strategy and the action planning. And to me, that's a really interesting one, because I know that within the strategy, there is a big commitment to listening to carers' voices. And that's one of the pieces of work that Essex County Council really want to get going and get involved in. And, how can we better hear the views of carers? Those who want to be involved on a regular basis, those who want to, have their say, but not necessarily coming along to meetings, those who want to kind of talk about a particular work stream out of those 6 commitments. But I think that's a really important commitment. And I suppose what we're doing today is exploring if there are ways that we could support carers to get their voices heard. So they are the 6 commitments that Essex County Council have included in the strategy. And I think going forward from here, there's a great opportunity for all of us to be involved in shaping how that looks. I think it was circulated to those who indicated they were going to come today. If anyone hasn't got it, or has quite understandably parked it somewhere in their emails or even deleted it. But if anyone needs a copy of the carer strategy, please do get in touch. We can, ping you over an electronic version, and you can have a look, and you can spread the word, and you can talk to other carers that you're in contact with about it, so that people are kind of aware that this is coming down the road, and how can they really make a difference to it. Is that a fair summary, Lee?
Exactly, Veronica, thank you. It's really important. We have listened to carers as we've developed this strategy. If you read the document, we're actually talking to carers, and we've tried to be really, really mindful that you've told us a lot of what we don't do well and what we need to improve. So this is the opportunity for us to actually do that and start to work with carers to make things better. As I say, we know we aren't doing things great at the moment. That's no secret. And it's not ideal, but it's a situation that we're in. But over the next 4 years, we really, really need to turn the tide, and it's a system change. It's not just about us doing things better for carers. It's about us working with our system partners to make sure that they do things better for carers as well. It's a local authority's responsibility to assess carers. We need to get our own house in order. We need to look at that process and make sure that it's fit for purpose, which, currently from correspondence I've read, it isn't. So we have a lot of work to do, and it feels quite exciting, but we need people to come on this journey with us and to tell us how things should be, and to shape things with us. But thank you, Veronica. That was a really good summary of what we're trying to achieve.
Thanks, Lee. So I'm very pleased to say that we've been joined by Sarah Haynes, and Sarah is in charge of patient experience, as I said, across the MSC Hospitals Trust, which is Mid and South Essex, Broomfield, Basildon and Southend. And I'm hoping that Sarah's just going to be able to give us a very quick overview of patient experience. Who are they? What do they do? And how might you contact them? How might you support them, and how might you get involved with them? So I'm going to hand over to you, Sarah.
Thanks, Veronica. Thanks for the opportunity to come along today. And my first apologies, I'm on a course today and I'm sat in a quiet corridor. So I hope you've got a good signal. I'm on my phone, so I'm sorry. But thanks again for inviting me along. My name's Sarah Haynes. I'm Head of Patient Experience and I cover the MSC sites, primarily our main sites, Basildon, Broomfield and Southend. I work alongside our Powers and Complaints team. Patient experience I tend to describe as the more forward-thinking side of it. We're trying to get ahead of complaints and POWs. We don't want to be responding to things the wrong way round. So we try to be proactive in patient experience. Some of the things that we do as part of our team, we've got a carers steering group, we have an accessible information standards group, we have patient experience group. We do work on specifics. At the moment, we're doing a lot around health inequalities, which obviously impacts on carers as well. We have Just in Time for Carers Week with Veronica's support and her colleagues. We've just launched our new Carers Passport across the 3 sites. There's only ever been one before, I think, just for dementia carers. So we've taken it as a Carers Passport. There's a Carers ID. These are all available on our intranet pages for you to print off or type in and put really valuable information in there. The next part of that commitment is we're going to do a lot of staff training, a bit of a fuller launch next month, so that staff aren't surprised if they are shown a carer's passport. We want them to be confident that they can make reasonable adjustments for carers that are coming to the hospitals, and make sure obviously their needs are met at all times. It's, as you know, more than anybody, it's been a tricky old 2 years. Things have been changing as to access and support at hospital, but those things seem to be settling down now.
I think we're losing you a little bit, Sarah.
Carers policy for the trust, and our aim, we will be a carer friendly site. Is that better? Have I gone? Hang on. You can see me holding.
That's better. You've come back again. You've come back again now. You just disappeared for a little minute.
Is that better?
Yes, that's fine.
Better, Veronica?
Yeah, that's better, Sarah.
Oh, good. No problem. On our hospital website. Our hospital website's got the care. Thank you. I took you guys' point for our Carers to Act directory. And it's a similar kind of thing. So I'm sure that's something we could do with carers first.
Sarah, I think I'm going to stop you now, if that's okay, because your signal is a little bit intermittent.
Carers to put some sort of, I think that's really valuable. Wonders of miracles of technology.
I know. I think we're going to stop you there, if that's okay, because we're struggling a little bit with the signal. But thank you very much. And what we'll do is we'll put the links out to everybody who's at the meeting, so they can have a look on the website, because I can see it's on the website, so we can put those links out. Hopefully your signal might be okay to answer a couple of questions in a minute going forward?
If it's not, Veronica, I've got some stuff that I can send to you in email that answers the questions as well. So I will pass that on to the whole group.
That will be fabulous. Thank you, Sarah. Now, at this point, we were hoping that we'll be able to play a short YouTube video. But as you can see, technology is not always our friend. So we're going to see if we can play the video. And if not, I could be incredibly cruel and call on Sharon, who is our ICS representative, to give us a very 2-minute rundown of what is an integrated care system and what is an integrated care board. Are we able to try the video, Jenny?
I'm going to give it a go now, Veronica. No, it doesn't think that doesn't look like I can get it up, I'm afraid. So we can also send that out to everybody as well.
It's, in which case, I'm afraid, Sharon, you also have got a terrible job there, because I have to say the video is very good and does a really good job of explaining integrated care systems, which is one of those sets of initials that you might see kind of bandied about in articles in the press and wonder what on earth they are. But Sharon actually works in one. So Sharon will be able to tell us what an integrated care system is in a couple of minutes. Thanks, Sharon.
Yes, I'll keep it short. So I suppose if I think about ICSs, integrated care systems, in some ways, nobody should need to know about them, because they should just be operating nicely and smoothly in the background. What they do is that they sit behind all those front-facing services that you encounter, and they're responsible for the strategy, for the commissioning, for the to make sure that services are delivered properly, deal with tackle inequalities, all that sort of thing. So in some ways you should know about them. In other ways though, and the legislation is changing very soon on the 1st of July, you do need to know about them, because they're a good way of expressing your voice. So I think that's probably why you need to know about them, I guess. As that slide says, integrated care systems are partnerships of organisations. So quite a few years ago now, about 6 years ago, the government split up the England anyway into about 40 different places, different STPs they were called then, but integrated care systems now. And the idea was that things are done better locally if you've got local knowledge and so on. Now, you could argue what local is, but how you define local. But basically, the ICS I work for is Suffolk and North East Essex. So in terms of the Essex footprint, I am Colchester and Clacton and Tendring, but not the other bits of Essex. However, there are other ICSs that do cover Essex. So I think the most important thing to say is that from the 1st of July, we didn't used to exist really legally, but we will exist. And there'll be two primary elements to integrated care systems. One is the Integrated Care Board, which is a partnership of all those things in those circles and others. Really, it's around the statutory services, NHS, local authorities, and it's also the voluntary sector as well, like Carers First, who've been working with us for a long time now.
So the ICB, the board, is responsible for the planning and the delivery of NHS services, but it has to do that in partnership with those other organisations. So the actual board itself is made up of a number of organisations. It's not just the NHS talking to itself, if you like. And then there's the Integrated Care Partnership, the ICP, which is leads on strategy. It's the committee that decides on what the strategy is for Suffolk and North East Essex. And then it holds the system accountable, the health and care system accountable for whether that strategy is delivered. So there will be various legal duties on the new board. One is what they call to deliver integrated care. That's a bit of a jargony word, probably, but what it means is what we talk about joined up. It means organisations talking to each other, the hospital talking to the GP, talking to social services, talking to a charity that works with you, for example, and making sure that information is shared and that they are all part of that personalised planning and delivery of care that we're supposed to be doing. It's also about having data, and so I'm a social worker by background. My background's in local authorities. I can tell you the NHS swims with data and information, but it's not always the data you want. So we can have better data, more accurate data. And then sitting underneath that integrated care board, there are what we call alliances, so they're more local. So in our area, we've got Colchester and Tendring is a place, and there's an alliance of organisations that work in that area. And then underneath that, or within that, it's not a hierarchy, it's within that, are what we call primary care networks. And they are networks of GPs, pharmacists, other community health services that work on collaboration with other services and also have a focus on prevention. So that's kind of it, really. Will that do for now? And then I can say more in the questions.
No, that's admirably clear, Sharon, because I know it's an incredibly difficult thing to kind of explain to people. What is an integrated care system, and why is an integrated care system?
Why? We all ask
that. But we're all going to have to kind of get used to it, because it is going to be the way that services get developed, managed, you know, and evaluated and reviewed and everything else. So and there are some great opportunities again for carers and local residents in general to get involved with what happens in health in their locality. So it's just good for people to be aware it's very, very imminent and starting on the 1st of July.
Yes.
So what I'd like to do, if I may, is to go to some of the questions which carers sent in to us. And our panelists have had, as Lee alluded to, a very brief sight of these. I kind of grouped them together, but I might jump about a little bit because some of them kind of sit together more than others. I'm going to start with one and obviously kind of address them to all three of you if Sarah is still in the corridor. We've had a number of questions from carers who are working carers, and they are really concerned about the support that's available to them as working carers, how the new carer strategy might better support working carers. And another carer asked about working carers who have their own health issues, and how they kind of felt that sometimes the balance wasn't right. Sometimes they were considered as a carer rather than as a person with their own health issues in their own right. But clearly, they've got a dual role. They're a patient and they're a carer for somebody else with different health conditions. So I suppose my question to the panel is, you know, how does your organisation support working carers, and how would you like to see that kind of improve and change as we go forward in the next few years? Oh, Lee's got her hand up, so let's go to Lee first.
Well, I wanted to stress that, you know, within the new strategy, employment and employers is an area that we know we need to look at and work on. A lot of carers who provided us with input to the strategy are working carers who raised this issue with us in terms of, actually, I'm a carer, but I'm also someone who has my own health concerns. So, you know, where's the support for me? We need to look at how we look at support offers that will support the majority of carers. You know, carers are a unique bunch. You know, they all have different needs, etc., etc. So I think we can't, one size is not going to fit all. So what we need to do is, with the resources that we have, is be as clever and as innovative as we can to sort of make sure that support covers a plethora of people with different needs. We at ECC have a very good carers forum. We have some really good support in place for people who are working carers for our organisation, and as part of the strategy and working with our partners, it's something we want to see across other employers in Essex. And I'm not just talking about your large employers. I know BT are a very good employer of people, offer good carer support. I'm talking about the small to medium businesses that have a small workforce but a dedicated workforce, and some of those people are carers. So it's how we sustain them in that role, should they choose to be in that role, as well as caring. So a lot of work to do. I don't know what the answers are, I don't know what the solution is, but it's something that we're going to be working on in the next few months to sort of look at the plans. And this is where carers will be playing a massive part in actually steering us through, well, you know, I'm a working carer and this is how working impacts me, or I'm a working carer but I also have my own care needs and these are the impacts to me. So we need to talk to more carers to understand exactly what it is we need to be putting in place. I can't say that we'll put everything in place that people have told us, because that's being unrealistic, and it's not setting the right expectations for our working carers. But what we need to do is listen, understand, and then turn that understanding into action.
Thanks, Lee. Sharon, was there anything you wanted to say about working carers in particular?
Yeah, I think I suppose my thoughts are about the ICS, but also, you know, when I used to be a social worker, I think I remember when the duty to assess carers' needs came in originally, and when I used to, I'm going back 25, 30 years, but certainly I don't suppose it's changed that much. When you initially assess someone's needs and you talk to a carer, that what they first say is, what I want you to do is to meet that person. If you can meet the person I care for's needs, then you'll meet mine. And they're not kind of free enough, if you like, to think about what their own needs are. And I think, you know, certainly at my age as well, you know, you care for children, you care for parents at the same time, and you're working. Oh, thank you, Lee, I'll do that. But, you know, I think we need to make sure that carers have the space and the confidence to really think about their own needs, because they're so busy juggling things. I think one thing is around definition of carers. You know, as I said, you know, we're swamped with data, but I'm thinking about the COVID vaccine programme, when all of a sudden all the carers organisations and the Alzheimer's Society and people like that were all saying, carers, make sure you get yourself registered as a carer with your GP. People don't define themselves as carers, they just struggle on. I think we need to do better with that. And I think this does apply to working carers, particularly because of the age group, the working age group that we're talking about, and work is just one other thing. I think the thing about, yes, so that's the thing about balance. I think the other thing is that we are in a better position than we have been, because the NHS is, I think, more explicitly recognising the needs of carers now. I think it's always known, but there are now, you know, there's a personalised care strategy that we have locally, which we haven't had before. I think the NHS, I'm sure you know, they'd agree with me. They're catching up with where social care has been, and social care knows it's not in the right place, but the NHS is getting there. There's a strategy there, and they're finally recognising that. So I think the approach needs to be personalisation more than anything. So if you're working, not working, I can't see all the chat, but Somebody said I'm an unpaid carer, and work is not just paid work, it's all the other things that we do in our lives and the other things that we balance. And I think whatever people's circumstances, we need to support them to do what they need to do for their own needs. And women particularly. We've got lots of women on here, haven't we? But I'm not excluding men, but we're trained throughout our lives to put everybody else first, aren't we? I think that's the thing.
Thanks, Sharon. I think Sarah may have fallen off the end of the call. I can't see her on the participants list there. So, but what I would say is there are huge numbers of working carers in large organisations, as Lee alluded to, of which hospitals are one. And I think there's certainly pieces of work for us to do with our partners. Lee is quite right. ECC have a fantastic employees forum that does lots of things throughout the year, not just in Carers Week. But we have lots of conversations with workplaces. And I think the message we try to get across to employers is try and put policies in place before something happens. So don't wait for one of your staff to come in and say, oh crumbs, my mum's had a diagnosis, or this has happened, or I'm going to need time off to support somebody. And then you're thinking, well, what do I do now as an employer? Do I give them the time off? What's everyone else going to think about that? What you want to do is to have an honest conversation with the staff and to have your policies and processes in place so that you don't have to wait for a crisis and people feel comfortable to come and have that conversation with you. And there are lots of really, really straightforward things that people can do that don't cost money. And they can look at things like having carers passport schemes that people keep with their personnel records, and you can just download them from the internet. They don't cost anything. There's lots of cost-effective ways to support employers. And that again feeds back to all those commitments in the carer strategy about, having processes in place, spreading the message about carer awareness so that people can have those conversations. I'm aware that, sorry, Sharon, carry on.
I was just going to say, I think it is about policies and procedures. I think it's also about not paying lip service to those policies and procedures. I think it's about embedding a culture where you support carers throughout your organisation. So you can have all the policies you like, but if you're a carer and you feel stressed and you can't take time off because you're worried about the impact it has on your colleagues need to be allies to you, really, and kind of say it's okay. I think it's about a whole organisational culture, isn't it?
It is. I think you're quite right. It's about people feeling that they could approach their line manager in the first place. And you're quite right. You can have any policy you like, but if nobody is trained in it or ever applies it, it's a waste of paper. So it's got to be a living document, and it's got to be reviewed, and it's got to be useful. And I'm mindful again. I don't wish to put Lee on the spot, but there were a couple of questions that were around working carers, and I just think it's worth flagging them up to ECC, not necessarily for responses, but we had a couple of different carers submit questions which said they would really like to work. They would like to work full time. They feel they would benefit from it. And from a financial perspective, especially in the current climate, people feel that they as a household, they as an individual, would benefit and would have a better quality of life if they could work full time. Both of the carers are looking after young adults with an autism diagnosis. And what is extremely difficult to find are kind of day opportunities for those young adults they're looking after so that they can actually go to work and earn, not minimum wage, preferably, and be in a place where they get the things that we all expect when we go to work, like auto enrolment in pensions or sickness leave or paid holiday, because they actually don't get that in their caring role, clearly. But also one of our carers has said that they are self-employed because that is the only thing that allows them to juggle their caring responsibilities with any kind of work. But that is not what they want to do, and it's not where they want to be. So I think there's certainly something about people caring for particular groups of people with different health conditions that makes it really difficult. And I don't know if you want to come back, Lee, or not, but it was interesting that of the questions submitted, there were 2 very similar from different carers, but in very similar circumstances. And
I suspect one of those carers has come through to me in another way. So I think Councillor McKinley has picked up one of these particular carers, and they're 2 individuals with individual circumstances, and I wouldn't want to comment entirely on support available, but what I have done is reached out to the lady that's come through, Councillor McKinley, and said I really would like a conversation. I need to understand her situation better. She's got an adult, a young adult with an autism diagnosis, and she wants to work because obviously of the cost of living, etc., and all she wants, and this is all she wants, is someone to sit with her son so that she can work on the days that he's not at college. Now, that's very simple and it's very straightforward. And so I want to understand what involvement she's had from social care, etc., before, but it can't be that difficult, surely. I mean, I'm sitting here as a fairly sensible adult. It cannot be that hard to source what this lady needs, just so that she can become, an active member of the workforce, because that's what she wants and needs to do. So those 2 particular people, I'm sort of going to pick up on an individual basis, because I really need to understand a little bit more. But it's not unusual what we're hearing, and they have been parent carers, and are now moving into the world where they're cared for as an adult. So what support was there when they were parent carers? And it doesn't sound like there was a lot. So just need to understand those situations better. But it is something, employment and working carers is something we're going to pick up as part of the work and the strategy. But yeah, I'm really very aware of particularly one of those cases has come through another angle. So, but I am picking it up directly with them. I've asked for a proper conversation so I can understand exactly what's happened. Before, I'm not going to jump to a solution and say, oh yes, we can do this for you, because she may have tried and tested these things. So it's just a case of let's have those conversations.
Thanks, Lee. No, I appreciate, as you say, we're not here to kind of go through individual cases, but it was just struck me that 2 people had actually had very similar experiences and had the same difficulties.
Exactly.
Another question we had from one of our carers was that they were looking after their partner, felt they had basically kind of lost their own identity and given up sort of a lot of aspects of what they previously did, but were really struggling to access all the information in one place, and felt that there really needs to be a better joined up approach between health and social care around consistent information giving, whether it's benefits, whether it's services. And obviously, again, that's in the strategy. We talked about care awareness, we talked about access to information. I wonder if there's anything, I'm gonna put it out to Sharon here. I wonder if there's anything that you think the ICS gives an opportunity to kind of get that information, whether it be in primary care, whether it be in pharmacy, whether it be somewhere else. Is there a way that we could use the opportunity of the ICS to get that information out to carers better?
I think there is. I think we've started on the journey already, as I said, those alliances of the health and care organisations have been in place for a few years now, and they're developing. I think they were kind of quite NHS heavy, and they're less heavy on that. They're much more collaborative these days. Somebody's asking what an ICS is. So it's an integrated care system, which is the health and care organisations. So the NHS, local authorities, whether that's social care or the district and borough councils, and voluntary sector organisations all coming together under one umbrella. So in Colchester and Tendring, there is an alliance of those organisations. And I think whereas before what's happened, it's TLAs, Barbara, 3-letter acronyms that the NHS and social care are very good at. Always call them TLAs.
Thank you.
No problem.
I'm doing the worst thing ever. I'm trying to do 2 things at once,
right.
And that's with, as well as listening to you, which is all very, interesting.
That's fine. That's fine.
Apologies.
No worries at all. So so I think historically what's happened is that GPs will get sent a bunch of information on resources they'll be drip fed that every now and then. Same with social care, same with hospitals, hospital wards. It depends on whether somebody's seen the leaflet and thrown it away as to whether they mention it to a person or not. It's, every organisation, every individual in those organisations, they've all got their own, in their heads, their own little resource pack of what information is available. We should take this as an opportunity, you're quite right, Veronica, to do this more systematically. And because there is that partnership there's an opportunity. But what I will do is take that back, and I'll feed that back to the alliances that maybe that's one of their first tasks they need to do, is make sure that they collaborate so they share information properly. Another thing that's helped, I think, is the development of the social prescribing, which some of you might have heard of, which is when you encounter NHS services and they see that maybe there might be community services that could help the individual, whether it's themselves or carer, somebody they care for, then they can. There are a number of roles called social prescribers, and they can help people to access community services. So they will have quite a comprehensive knowledge of what's available. But I think it should be that everybody we come into contact with, whether it's a nurse on a ward or a GP receptionist or, a doctor somewhere, everybody should have the same information, and you're quite right. So I'll take that back.
Thanks, Sharon. I mean, I think it's, as long as I've been working in carer support, engaging with kind of primary care has been something that we've struggled with. Yeah. We've had some really successful examples, and then we've had other areas that don't really want to talk to any organisations about carer support, whether they be Essex County Council or the CCG or the ICS or Carers First or somebody else or the Alzheimer's Society. Yeah. So it's just, again, I think it's the consistency, and that's a message we get back a lot from carers, that sometimes people will go to a wellbeing group and a carer will be saying, my GP surgery is marvellous, it's done this for me, it gives me double appointments, I'm on the carers register, I get called for my flu vaccine, and the person sitting next to them who lives 2 miles down the road but goes to a different GP surgery says, well, I don't get any of that at all. So I think what we know there's good practice out there, and we know that it can work, and we know from the feedback we get, and actually from the professionals' feedback, but it's just how we get everybody to at least a kind of level playing field to start with, and then hopefully can build on that. But it's a long-standing project. Yeah. I'm going to be really mean and go back to Sharon again for another question. But do you think, and this is real kind of licking your finger and kind of sticking it in the air and making a guess, Sharon, but do you think that the ICS and the ICBs and the new structures in healthcare, is that going to improve some of the difficulties that we've seen, obviously nationally and locally, in primary care? People saying that they struggle to access their GP, people finding an NHS dentist, which can be incredibly difficult in some areas. Do you think that that's going to help the general public with some of those kind of everyday health things that people should find really easy, but actually find really stressful?
So I'm not going to hand on heart say yes by, you know, the 1st of April 2025 this is going to happen or that's going to happen, because you know, well, as we know from pandemics, stuff happens, doesn't it? But I'm not going to. It'd be wrong of me to give a firm promise that this, you know, everyone's going to get access to a GP whenever they want one, or a dentist. However, what I do think is that we have the opportunity to create a few things that can make a difference. So over the next few coming months, really, the response, so primary care, GPs, pharmacy, dentistry, optometry, eyes, also various things, they are transferring, they have been commissioned by NHS England centrally on a national basis, and in the coming months that will transfer down to the integrated care systems, so they will take on responsibility for that commissioning. So what you could argue, that's just shifting one lot of bureaucracy from one place to another place, and certainly that, I'm sure that will be the case. But what it does is it creates, because the integrated care boards and the integrated care partnerships, which form the ICSs, because they've got legal duties to be responsible and accountable to local people on their patch, what it means is that you're not kind of just shouting in the ether, what it feels like in the ether. There are going to be people locally who are directly responsible and who you can, you know, share your voices with, and you can. They have a duty to listen to what you say. So I think what will come across, it shouldn't be postcode lotteries, but what it should be is more responsive. So, for example, we all hear about these deserts, they call them, don't they, where there's no NHS dentist. There should be more flexibility to you know, fill the gaps so that we don't have those deserts. It's going to take some time, I'm sure it will take some time, but I think we all know, you know, in the NHS, in social services, in the voluntary sector, in the districts and boroughs, we all know what the issues are. We see them, especially dentists, you see that stuff in the press every day, don't you? We know what the issues are. I think the more local approach as compared to the national approach, and those local responsibilities, gives us some opportunities to do things differently. One of the things that they're talking about as well nationally, but I think we can take a local approach, is, you know, we always hear that GPs are struggling with workloads, and there are things that, for example, pharmacy can take on. So I was given an example the other day that if you've got high blood pressure, obviously you're at risk of a lot of different health conditions, aren't you? Heart problems, stroke, etc. And that there are, I didn't know because I only just found out, but there are what they call enhanced pharmacies who can carry out some of those tests. So when you wear the thing for 24 hours, whatever it is called, I'm conscious of recording this and I sound very you know, inefficient with my lack of using the right terms. But the trace that you can wear, you know, some pharmacists can do that. So that saves you, what does it save you? An appointment to your GP asking for one, an appointment for your GP to get it, someone to put it on, an appointment to go back and find out. It saves some of that toing and froing. And by spreading that and using the expertise, particularly with pharmacists, I think, you know, we have opportunities to relieve some of that pressure on GPs, hopefully, so that GP appointments are easier to get, and that we get the right advice. You know, pharmacists, particularly, a relative of mine was on quite a rare medication recently, and the GP kept saying, "I don't understand this medication. I don't know anything about it." But the pharmacist was, you know, brilliant and said, oh, these are possible side effects, and why not take them at this time of day and that time of day? It's brilliant. You know, they have all sorts of knowledge that we don't tap into enough. So there's lots of options like that, I think. The other thing also is, I don't know if people have heard of primary care networks. So all the GPs in the country were asked to get into little local groups. So there are several primary care networks in Colchester, several in Clacton, and the focus has been on prevention, but they are a network, they're an organisation. So if you want to make your voice, and I absolutely recommend that people make their voices known, there are options. I think that's one of your other questions, isn't it, about being heard, isn't it? How can I get involved? Get involved and make sure you know who these systems, these networks and organisations are, so that you can shout. That's always my approach.
Well, it's good to see Morna's just put in the chat that she's, you know, having really positive experiences of primary care.
Good.
Not in Essex, I have to say, but next door. So, which comes back to what I was saying. Really, there's lots of good practice out there. Yeah. It's just about us trying to, you know, get that good practice everywhere and not just somewhere. But thanks, Sharon. It's you know, it's not a quick fix, is it, to suddenly magic up lots of NHS dentists or anything else. But thank you. I wondered if I could just go back to Lee. There's a couple of sort of unrelated questions here, Lee, but one of them was about kind of action plans coming from the strategy. Yeah. And do you think there'll be any kind of, obviously there'll be some kind of benchmarking to say, like, by the end of 2023, we've got this in place and that kind of thing. But one of the carers asked, would there be things like a maximum waiting time for carers assessments? Now, that's always a bit of a difficult one, because some people have a carer's assessment on their own, and some people have a carer's assessment with the person they look after, and you know, people's circumstances are all very different, and some people are very limited in the time that they could give to social care to even arrange to have a carer's assessment, going back to the discussion about working carers and all those sorts of things. So there are always lots of kind of variables, but do you think that is something that adult social care would be looking at?
So first of all, you know, in terms of carers assessment, sorry, let's talk about the action plans. There will be timelines. It's a project, you know, in speak, it's a project, so it will have timelines, milestones, dependencies, all that kind of thing. And you know, I mean, my view is we should publish that as a ongoing tool to assure carers that we're actually doing something. So that's the first part of that question. The second part around, you know, time scales on a carer's assessment, I think there's a legislation question there. You know, is it set anywhere that, you know, once you've had a referral, by 20 odd days you need to have done an assessment like they do with you know, a normal assessment? So I need to check that out. And we know that our current processes are not working for many carers. Carers have had carers assessments and don't even know they've had one, even if they've had a payment as part of that carers assessment. Carers have been involved in a joint assessment. It hasn't been a joint assessment, they've just been in the room. That their views and their eligibility and their needs has not even been thought about, let alone taken into consideration. And if a carer has had a carers assessment with no further action, and so what? What was the purpose of that for me? It was 30 minutes out of my day that I really couldn't afford to give up. What was the point of that? So there are three things that we really need to look at and focus on. You know, a carer's assessment has to be meaningful to the person that's asking for it, has to have a proper outcome for them, that actually, you know, this is your eligible needs, this is the support that can be put in place for you or not, and it's just pulling that forward. So yes, part of the commitments is looking at our own processes, etc. I wanted to sort of pick up where Sharon was talking about data. We in Essex have lots of data, but it's madness, it's crazy data. We you know, we have got so many carers that are registered and are on our case management system, but a lot of those carers are no longer caring, and a lot of those carers are no longer with us, let alone caring. You know, and so it's we have to balance doing a really stringent data cleansing exercise against upsetting some, carers who have told us numerous times that they are no longer in a caring role. So, there's work that we need to do there. But back to assessments, we know we need to get our own house in order, and that is going to be part of one of the commitments going forward. There's going to be an action plan around that.
Lovely, thank you very much. I mean, I think that kind of links into the other question that was here, really, about kind of direct payments, which obviously might be something that would come through a carer's assessment, although lots of carer's assessments will not result in a direct payment. There was a question really about challenging them and kind of better understanding of the reasons why, a decision was reached, whether a direct payment was awarded and what it was awarded for, and if you thought, actually, no, that, either I should have one or I've got one, but I don't really want it for that. How people could kind of, challenge might be the wrong word, but kind of open up more of a dialogue, really. So they felt that, again, it's back to that, they felt that they'd been listened to rather than being given what somebody else determined they needed.
May I interrupt here a little bit, Veronica and Leah? You'll find that I've put something in the chat about payments as well, which is very.
I can see that, Barbara.
You need to look at that, and this issue needs to come up for discussion, if not today, at some time, on behalf of a vast number of people that receive personal budgets.
Thanks, Barbara.
Okay.
I did see that. So, we'll definitely come back to that one. If not today, as you say, then we'll follow that up. Thanks.
Yeah, I can't actually see that, Veronica. But we'll come back to that one. But no, in terms of the question that was raised, so it's around clarity of the use of direct payments awarded and those being looked after, etc., etc. I sought advice on this because I'm not as close as a direct payment as I could and should be, and direct payments are awarded as a result of eligibility criteria from the care and support guidance, and challenges can be made. I mean, if you don't challenge back to the person who gave you that money, so your social worker or the person that organised the direct payment, then the advice is go through our complaints team. It's not ideal, but that is the advice that I was given in terms of answering this question. So if you don't challenge back to the person that allocated you that funding for whatever reason, like it wasn't for what you wanted, or that's not what we discussed, or challenged the amount given, etc., then it would be going through our complaints team. Again, that doesn't feel ideal to me, but I wasn't competent enough to answer this question because I'm not that close enough to the detail.
No, I appreciate that, Lee, and it's a perfectly valid mechanism. I suppose it's just about, it feels a shame people have to go to a complaints team. You'd like to think there'd be some kind of informal resolution, a bit like in hospitals, really. If Sarah was on here, you always go for kind of informal resolution before you with pals, before you go down a formal resolution route. And maybe there's something about that. I'm just conscious of time. I think perhaps we could do one or two more questions, and then we'll probably have to draw ourselves to a close. I actually wondered while Sharon's here whether you'd want to comment on challenge to kind of health issues at all. So if carers had a challenge that they wanted to go back to either a primary care. We did actually have a question for Sarah about going back in acute settings as well. In acute settings, it's often around asking for a second opinion about something, which you don't tend to do in a GP surgery very much. But is there some kind of advice or anything that you'd want to say to carers about kind of opening up that dialogue better in health?
So I definitely think people should challenge. I think, I think what happens often is that organisations, whether it's health or care or anywhere else, with BT or anybody else, I suppose, get defensive if they're challenged. But I think that's, we shouldn't put up with that. I think people often say, oh, you know, those who shout loudest get what they want. Well, somebody needs to shout, and I'm always behind people who shout, definitely. However uncomfortable and annoying an organisation thinks it is, they need to do that. As I said, I think there are opportunities we have in the new systems to make sure that people can shout. And we also need to make sure that those people who are not used to shouting, which tends to be the very old, the very frail, those with communication problems, those who are, you know, use different languages and so on. I think they're the ones we need to listen to most, because they're the seldom heard. And by heard, I don't just mean, you know, physically hearing somebody, I mean actually properly taking on board what they say. I think there's an increasing openness to hear about stories, actually. That's what comes across to me. And I think, as I say, shouting is important because that is a way of sharing a story. I would say share your stories in different ways. So, as somebody mentioned in one of the questions, patient information group, patient engagement groups at GP practices. They're great, but they tend to be people who don't work, who have time on their hands to attend the meetings and so on. But don't forget, you've got other patient groups, you've got adult social care have groups, organisations like yourself, Veronica. You provide the opportunity for people to have a collective voice. But don't forget your MP, don't forget your counsellors. Don't forget media, social media. Make sure that everybody knows how you know, the different ways in which they can make their stories known. It's surprising what social media does these days in making organisations listen to individual stories. I think that, what would I say? The advice I would give is yeah, get together and have a collective voice. And if there are opportunities open to you to share your voice, either through Carers First or through organisations like Health Watch or anywhere else, take them. Because if you don't say, people don't know, and they don't have to listen, do they? Oh, sorry, somebody's saying.
Thanks. Yeah, thanks, Sharon. I think that's a very good point, that there are opportunities, and sometimes it won't be the right time for you, and you haven't got the time and you haven't got the resilience. But if you have, if it's the right time for you, then there are avenues. And I would say I've got my patient participation group tonight, and we don't meet during the day. So in my volunteering role for Carers First as a GP Link volunteer, I've got my meeting tonight. So they're not all about people who are at work in the day.
But that's also the thing, isn't it, Rob? You're absolutely right. When people are going through tough times, they don't feel resilient enough. But that's where organisations like yours come into their own, because you can be a voice for somebody else.
And I think your suggestions of Health Watch, and there's NHS Choices website where people can post reviews and things. There are opportunities out there if people don't feel they want to go and speak in front of an audience, but you can still give feedback through different mechanisms. I'm really mindful of time, and Jenny has asked me to say that any of you who are on the call, who are carers, and who are not currently involved with the sort of Carers Forum, which is our cross Essex kind of voice for carers. So I know many of you are involved with local wellbeing groups and access local activities, but we do have a Carers Forum that meets online and is involved with all sorts of things. The event today actually originated from the forum. So it was the forum's idea to put on a question and answer session in Carers Week. Clearly they were involved with the consultations for the carers strategy, but they've also been involved with Sarah's team. So patient experience came out when they were doing some consultations in kind of February, and came along to one of the online meetings and asked people about their kind of experiences as carers, either as a patient in hospital or supporting another patient in hospital. What was good, what was bad, what would they like to see change post-COVID, that kind of thing. So there's lots of opportunities to come along and both be involved in things that are already happening, but actually bring your own ideas, and we'll see if we can make it happen. I'd just like to say a huge thank you to Lee and Sharon for coming along today. I'd also like to say thank you to all the carers who've come along today. Thank you to Jenny, who has managed to share her screen and put all the slides up and do many, many other things. I hope you all have a chance to enjoy Carers Week, if that's the right word. But we really value your time. We really value your input. Those who've asked for various things, I've made a little note, so we'll come back to you with the things that you'd like to do. But if you've got any feedback, any questions, you're very, very welcome to email us so we can pass them on. Or if there's something for Carers First, then obviously we can look to kind of work with the guys in community teams and the hospitals teams to move things forward if that's what you need. And on that note, I shall wish you all a very peaceful afternoon. Thank you very much, and see you all again soon, I hope. Thank you. Bye-bye.